So you're looking at Inspire sleep apnea implant surgery and want to know what the first 72 hours is about. Well, I just had my procedure done about a week ago and want to talk through what to expect those first 72 hours. So I had the implant sleep apnea therapy done, the surgery done last week, along with a septoplasty to repair my deviated septum. So I had both procedures done. About a week ago, and those 72 hours to me are the crucial part, right? So once you get over the 72-hour hump, I'm calling it, everything becomes much more manageable. Still rough, still pretty miserable, but much more manageable. I had my procedure done on a Thursday, so by the time I got home from the surgery, it was midnight. So my first night of sleep was awful, and I mentioned that in my previous video, kind of what the first 24 hours afterwards looked like, but very, very miserable. I was sleeping in 15-minute increments. Again, mainly because of the septoplasty, because I could only breathe through my mouth. My mouth was very, very dry. I also had to sleep on my recliner because I had to keep my head elevated through the night to sleep. My body was sore. My neck incision, actually, I didn't feel it too much, the actual incision. My throat was sore though, so just even sipping water, which I had to do because my mouth was so dry, it did hurt. But it was like having a sore throat, like when you're sick. My chest, pec area, super sore, pressure, discomfort, from mid chest over. So it was a pretty miserable first night. I woke up the next morning, couldn't really eat, had a lot of soft foods. Again, I covered that in my other video, but just to really touch base on that. So that day was a Friday, took off of work, obviously. And going into the weekend, Saturday, Sunday, it was a weekend, so I just laid low and just rested as much as I could. Continued to walk around as much as possible, to the bathroom, of course, to the kitchen, things like that, just to keep moving and just kind of, especially after I would eat, I was very gassy as well from the anesthesia, just having pockets of air. And so just doing that movement and walking helped relieve that, a little bit. And because I couldn't really chew much, swallow, I couldn't really taste the food either because because my nose was all blocked. Appetite was super low, so I wasn't eating much. I ended up losing about 5 pounds through that weekend alone. And I really, because of the septoplasty, I did watch my dairy and my sugar intake because of just the mucus buildup, and I only have my mouth to breathe and to eat. So if you're only doing the Inspire, that might not be an issue. Chewing, swallowing, all of that will be an issue because of the incision on your neck. So just be aware of that. Having soft foods through the weekend that you can bear, such as soups, mashed potatoes, applesauce, yogurt, protein shakes, smoothies, things like that you can take. I also drink a lot of tea. I did not have coffee. I'm a big black coffee drinker, but I just read some things about how caffeine and coffee could, make congestion worse and things like that and swelling. So I just stayed away from that. Because I drink coffee every day. I did have headaches the first 2 to 3 days. Between the caffeine withdrawal, obviously everything happening with the septoplasty, the surgery, anesthesia, I'm sure it kind of all was the reason for the headache, but just something to keep in mind. So sleep by the second day, 48 hours in, was a little bit better. The tightness in my jaw and my neck continued, the pain, just not being able to open my mouth. I was prescribed Tylenol number 3 with codeine. I did take that the second night to sleep. And honestly, I didn't really feel that different than just a regular Tylenol. So I ended up I took that probably the first 2 nights and then just ended up continuing just taking Tylenol. I will say, and the nurse said this when we left, when I was leaving, she said, make sure to stay up on your Tylenol, if it's every 4 hours or every 6 hours or whatever the case may be, that you stay on it. Because, and I would know when it was time, because my chest would start hurting. Right here, my jaw would start hurting a little bit more. And I knew it was like, oh, it's time to take my Tylenol because it's wearing off. So, even through the night, again, the first 2-3 nights were so rough to sleep anyway that I was up. So if it was 3 o'clock in the morning and it was time for me to take my Tylenol, I would take, because I was up anyway. But in case you're able to sleep, maybe have someone kind of wake you up if you really would rather not be in pain, just to take that Tylenol. Because I had the septoplasty, I had the leak pad here that I had to change, constantly on day 2, because from day 1, there's just so much buildup of, dry blood and mucus and all kinds of stuff. You just have to change it. So I would change that. And, you're leaking, things are coming out. My incision here, and my incision on my chest from the implant, from the Inspire, didn't have to change that. That was solid, good. You're not allowed to shower for the first 48 hours anyway. So nothing, you're not allowed to get these incisions wet. So it wasn't an issue at all. I used dry mouth lozenges because my mouth was dry. That was the first 48 hours. After that, I guess I got adjusted to all the mouth breathing, that things got better. Plus just drinking lots of water, drinking lots of tea, just to stay hydrated, to help with the thinning the mucus, again, because I had the septoplasty. After 48 hours, I was so happy to finally be able to take a shower, even though it wasn't a full shower, right? Again, I can't get my incisions wet, so I had to use, we have a wand, a shower wand. So if you don't have one, I recommend getting a shower wand. It just makes it so much easier, because I would just use that like low pressure, and just kind of go right below my chest down, be able to wash and clean. So I did that literally. I hit the 48 hour mark and was like, I want to just take a nice hot shower. And obviously, because I had the septoplasty, just having the steam also helped a little bit. And so I did need help just taking my shirt off, because again, lifting my arm because of the chest incision was pretty difficult. So my wife did help me just to take my shirt off. I was okay in the shower myself, again, because I had the shower wand. So I would just use that. I would have to use my left arm to grab the wand, because again, I couldn't lift my hand up. So just be attentive to that. I did have to, I know the nurse said you could even take a bath, like fill up the bathtub. So if you don't have a shower wand, you could just do that. Or just be super, super careful of not getting the incisions wet. That's when I noticed, actually, when I took my shower, that they shaved my chest, because I kept the same shirt on, right, for the first 40 hours, from the hospital. I didn't even notice. I guess I didn't really think about it. It makes sense. But they only shaved, obviously, the area they needed. So it was just like from here down, it just it was shaven. So I looked pretty ridiculous, and I didn't notice it though until I'm taking that first shower and I look at myself in the mirror and I'm like, I look a little ridiculous. So they didn't ask me to shave beforehand. They didn't say they were going to. I didn't really think about it. Not a big deal. But it was just a funny moment, 48 hours in, when I actually realized that it had been done. So in terms of, talked about the pain overall here and the chest, keeping up with the Tylenol. Again, the Tylenol codeine, I took that for about the first 2 days, like off and on. I would kind of go from Tylenol to Tylenol codeine. And especially at nighttime, I used it. And I did start Miralax because of, again, the nurse said with anesthesia, with the change in diet, not eating, things like that, just having bowel movements could be an issue. So I started doing that on day 2 as well, because at that point it had been more than a day. And, when I was getting just from just the little bit of food that I was eating, I was getting gassy and feeling like I needed to go, but I couldn't go. At one point again, TMI here, tried to go. I tried to strain, and just the strain to go put strain on my chest, like the pressure. And so I was like, I don't want to, it hurts. So started taking Miralax, and that really helped. A day later was able to go and all that. And, so that was all good. Using the saline spray, definitely get one that has the push button down and sprays up. Because that, I do that 3-4 times a day, super helpful. I did notice by day 3, for the septoplasty specifically, obviously the leaking really slowed down, and like the bandages and things like that were much, much less. So I was able to take off the leak pad holder, that kind of wraps around my ears. That actually started hurting behind my ears. Like, if from COVID days, we would have to wear a mask if you wear those medical masks, and sometimes it would hurt in the back of your ears. So that was just, kind of a flashback to 2020. And so I was able to actually take the leak pad off and just kind of dab throughout the day. So that was by day 3, 72 hours in, which was great. And then at the same time on day 3, what I noticed was that the congestion from the septoplasty was like really bad. Like, it was just fully blocked. Like, there was just nothing. It was really, really hard. And even going to bed, I'm like, I can't even sleep. So I ended up using Sinex, which helps. Helped, within minutes. It helped clear up so much. But what I noticed is that the next day, they call it the rebound, the congestion rebound, that was like, it got worse than before I used it. So I did that one more night to see how that would help. It didn't. And I was like, you know what, I'm done using this. You can't use it more than 3 nights, they say. And so, I did use that just the first 2 nights to help. So they gave it to me for free from, when I left the hospital. So I just had that. Again, used it 2 nights and then called it, because I didn't want the rebound congestion. It was just really, really bad. So I called it the 72-hour hump because day 3, septoplasty, I don't have my leak pad anymore. My chest, the pressure here is getting a little bit better. I'm able to move my hand a little bit more, right? Because the next day I took my first shower was really hard to even lift my hand. By the next day, take my nighttime shower again, and I was actually able to take my shirt off all of myself. So just within those 24 hours, like, it was a big, big difference in terms of the movement that I was able to do with my arm. So my wife was a little concerned. Are you sure you can do this by yourself? She, obviously didn't want me to get hurt. And I was like, no, like, let me try. And, I was able to do what I could, and it was fine. So, which is great. So I was just starting to see little bits of progress, which was great, and just, again, taking those showers helped me feel more human. And, keeping up with the Tylenol makes the pain much more manageable once I was just sticking to that schedule. So I was really, once I got past that 72 hours, things became much more manageable throughout the week. Again, it was a weekend for me. So those 2 days, just, I didn't have to worry about work or, kids in school, things like that. So that obviously helped. I know other people might have this procedures like on a Tuesday, and like, you're missing a lot of the week. I only missed 2 days in terms of work, and, not cutting into, and having those 2 free days, right? Saturday and Sunday before I was going back to work. So once you get past these 72 hours, it gets so much easier. And again, I had 2 procedures done at once. If you only have one of the procedures done, I think it obviously becomes much more manageable. You don't have the double whammy of, fully blocked nose and can't eat. So, it becomes a lot easier. So hope that this is helpful. Please feel free to leave any comments, questions below. Happy to answer them. And until next time.